If you have back pain and you stopped moving, you are making it worse. Almost every client I meet regarding the low back pain develops the same fear of movement. Either it comes intuitively, from avoiding certain types of movement that triggered the pain, or unfortunately comes as an advice from a doctor. In most of cases, low back pain is not a result of an injury, but a combination of various factors. And tissue tolerance is one of the ways to improve these conditions, but it has to be stressed, it has to be challenged. Human spine is built for movement. Some parts of the spine are having a little bit larger movement tolerance, some are a little bit lower. Most of the back pains are within the lumbar spine, which has relatively low movement range. However, it can and should be moved. So instead of avoiding it at all, we should bring gentle, very lightly loaded movements. First exercise, come into the quadruped position with hands below the shoulders, knees below the hips, and perform very gentle segmental spinal flexion and extension. What it means is that you try to bend and extend your spine gently, but as far as you can without going beyond the pain level. You may feel discomfort, but don't shy from the movement. That's first. The second one, we lift one hand and we execute a couple of spinal rotations. That means that we turn the spine along the line, including your head rotation. So all this motion involves the entire spine. Eventually, we need to also start loading the movement, and oftentimes the movement that you may have triggers the pain is actually the very best movement to improve its conditions. Start with exercise that is called Jefferson's curls. So intentionally we try to bend the spine as much as possible, again within the pain-free zone. This exercise goes a little bit against the principle we try to follow when we do deadlift. In this case, we actually intentionally flex the spine part by part. As the movement feels a little bit better, we should start loading it to increase load tolerance. So you can grab 5, maybe 10 kilo weight, and we perform exactly the same movement, but now adding a little bit of the load. If you are missing space, you can stand on some elevation. And again, after 1 or 2 weeks, we probably would be able to increase the weight, the pain would diminish, and the whole movement starts feeling more and more comfortable. If you have back pain and you have been advised to stop moving, save this clip and follow for more.